All right, it's happening.
Okay, here we go.
Got a preview. Go live. Here we go.
Put this over here, maybe. Right. I think we are live. My phone's buzzing.
Yeah. All right. Great.
Okay, please send in questions.
Are you typing that in the comment section right now?
Yeah.
Perfect. All right, well, let's get started. I'll give us a little intro here. Hello, I'm Dr. VanderWel, everyone. I'm Aviva. This is Dr. Tan, and we are here for general question and answer for anything weight loss related and bariatric surgery, as well as, just a generic topic we're going to kind of bring up was mindset. And that's a huge piece of this journey. That's a huge piece of success. And it's actually one of the biggest, I'd say patients also say that this is one of the biggest victories in their journey with losing weight. And especially after like a bariatric procedure, is that they just feel like they're in such better control of their life, and their mindset's just in such a better place. So, yeah, with that, Dr. Tan, I think we had some questions submitted earlier.
Yeah, so let's
hit those
first. So Monica sent in a question ahead of time that said, I would like to know the timeline for an ESG. Is that the same as the other surgeries? If I already have tests and labs done, what is the soonest that I could get the ESG? I live in Portland, Oregon, so I can go a weekend and have the ESG right away, ? Maybe we can explain what the ESG is for anyone who isn't aware of that, and then answer the question.
If you want to explain it, I'll grab
I'll
grab some show and tell. Yeah.
Oh my goodness. Okay. Well, so the ESG is short for the endoscopic sleeve gastroplasty, which is a mouthful. You'll also hear it as the endo sleeve for short. I've started calling it the incisionless sleeve. And essentially what we're doing with the endo sleeve is we go in through the mouth with a long, thin camera, and a device attached to it. And we go in to the mouth, to the esophagus, and then into the stomach. And with that device, oh, that's really cool. With that device, we actually can suture the inside of your stomach. And as we're suturing that inside of the stomach, we're kind of scrunching it down. And it's reducing the volume inside of your stomach. And that mimics the laparoscopic sleeve gastrectomy, which is the surgical option here, where we go in through the belly and then we cut out most of the stomach. So we're doing kind of a similar operation without removing any of the stomach with the ESG. So very cool. It's a newer procedure that we've been doing and had good success with. So yeah. What are your thoughts about Monica's question?
Yeah, I think it's a great question. So if you already have labs and most of the workup done, then usually it's about, we've got to look at them, make sure everything's okay. And as long as you're a good candidate for surgery and all the, it seems like the endoscopic sleeve is going to be a good tool for you, Monica, then usually it's just about finding a time on our schedule. And so usually we book somewhere between 2 to 5 weeks out, depending on the time of year and depending on, what the schedule looks like. So yeah, that's about as quickly as it can happen.
Yeah. And I will say, we do not operate on weekends. So we cannot do your surgery on a weekend routinely. But I think very reasonable to maybe come in and then recover over the weekend. Or if you're just thinking like a 2-day kind of trip, I think that's reasonable as well. And I would also caution our patients from like doing tests and labs on their own, just because we do kind of guide you through that process. It's kind of rolled in to our entire way of doing things. It's fine if you've done some labs with your PCP, but okay if you don't.
If you don't have them, if you don't have labs done already, usually labs are pretty quick to be able to get done and to get results. It's rare that if you're moving with purpose to get your labs done, that's a limiting factor.
Yeah. I have a question on my feed here from No More Munch Munch. Does the effect on ghrelin happen with the ESG?
Yeah,
That's a great question.
that's a great question. So we do see an effect on ghrelin. This has been seen in a couple studies. It's not as much as a laparoscopic sleeve. But there's an effect, and there's an effect with a bunch of the other hormones that we see with bariatric surgery as well. We just probably don't see it to the magnitude. It's also hard, I will say that a lot of those studies have been done in a little bit less aggressive endoscopic sleeve than we usually do. So like in my endoscopic sleeve, I actually go up into the fundus and close a lot of the proximal stomach. And I think that, and we've had really good success with that. And, it's been safe in our hands, in our experience. And I don't have ghrelin levels on my own.
we don't track ghrelin.
Yeah, ghrelin's actually a very difficult test to run. Ghrelin's a very sensitive molecule. It breaks down really quickly. You have to have very specific parameters and very specific labs that can run that test. So, that's not something I routinely do, unfortunately. But we have seen benefits of ghrelin levels for sure. I think in the realm of tools to treat obesity, the laparoscopic bariatric surgeries are probably they're stronger tools. They have more of a hormonal effect. There's more, there's more like the physiology changes more, the anatomy changes more. The endoscopic sleeve is like the next best thing, I'd say, as far as like there's still a lot of anatomy change. There's still a lot of physiology change. It's probably not quite as much on average for every single person as we see with the laparoscopic sleeve. That being said, the bar there's a lot of overlap in those patients and how well they do. And then what we see with the medications is that the medications kind of they're not quite I would say as strong as either of those, but the medications interestingly seem to augment the surgeries in interesting ways. Like most of the time, if someone has a surgery, there's still actually quite a bit of benefit that they can get from a medication, which is very interesting, how they can actually work together well synergistically. So yeah, I think, my 2 cents is that in 5 years, kind of our standard of care will be a procedure and medication, kind of same thing we do with surgery. I mean, with cancer.
Yeah. Yeah. I think that's a really good segue because I think the medications, like my favorite part of the medications when I prescribe them to patients is the mind. It does address actually, I think, the mindset piece in it, that it helps with some of the practices and like behavioral things that will sometimes shift as you move further along after surgery. And so I think it actually does help with that a lot. I was going to start this conversation with, do you think mindset matters? Which I think very clearly both of us feel like it does matter to a degree.
Mindset's everything. Mindset is everything. Like this is a really stupid thing I say all the time, but it's very wordy, so I don't think no one ever repeats it. But the body cannot follow where the mind does not lead.
That's beautiful.
And
did you come up with it
yourself? But it's really true though, that like you're never going to get somewhere where your mind is not like focused on taking you there, unless you're just traveling downstream with inertia of whatever direction you're going. But like if you really want to achieve something, you're never like wake up one morning, you're like, oh wow, I've achieved so much. Making progress on anything takes a lot of planning to make changes. It takes a lot of planning, takes a lot of work. It takes a lot of, and all of those things start in the mind. They really do. And so, when your mindset's in the right spot, it's an amazing thing that can happen. The question that always comes up then is like, well, why do you even need surgery? Why do you even need a medication? Like, if you can just change your mindset, like get your act together. And what's interesting, and this is where I think the GLP-1s have shown this to a degree that people have not realized on this scale, which is that the mind is so pervasively pursuing food that if you can get a little bit of biological help there to really to get a tool to really tame that and to curb that edge and to change some factors in there, you can still have that desire but not achieve it, right? And you'll finally be able to achieve it. It's like I kind of tell this to people like all the time, like no matter how badly you want something, even if you're working as very hard as you can, sometimes your biology just won't let you do it, right? No matter how badly I want to run a 5-minute mile, I don't think I'll ever run a 5-minute mile in my life. You know, like
I'm definitely not running a 5-minute mile.
That's not in the cards for me. You know,
not even a 7-8 minute mile.
Yeah. So like there are certain limitations. And what's interesting with, but then the question is always like, but I mean, this is like how all this, why suddenly obesity is such a problem? And it's, you know, that's a complicated question, which I think is a huge part of it is like our lives are set up for obesity in every single way. All of the comfort that we have, all of the food that we have access to, all of, you know, the different climate controlled environments that we live in, the transportation methods and the work things that we do. And like all those things are such a big setup towards obesity. And the problem is that once you are struggling with your weight, going backwards becomes extremely, extremely hard. If you don't get there, then it's a lot easier to keep yourself from being there. But if you're there, the chance of you actually making progress and getting to where you want to be is just unbelievably unlikely. Like it's in the single digit percentage points of actually making meaningful progress towards your weight and keeping it off. So we should probably let's hold on a second. I got like a lot of comments I got to catch up on here. Thank everyone for commenting. Sorry, I got a little pedantic there. Kamlesh Patel, hello, Kamlesh. I'm sorry if I'm saying that wrong.
Hello.
Katie, I've had a lap band for about 20 years and my doctor said it should come out and wants to do a sleeve. Can you remove the lap band and do the ESG during the same procedure? Yes, that's very possible to do. They are different modalities. So the lap band is laparoscopic. You can't take out a lap band endoscopically unless it's eroded, which very unlikely. And you don't want to do an ESG at the same time as that anyway.
No.
So you can take the lap band out laparoscopically, and you could do an ESG in the same procedure, in the same go. That's absolutely a possible thing. And honestly, I haven't had one that I've done that way. Technically you can even keep a lap band in and do an ESG around it. That's been done before. I have done neither of those so far. I generally prefer to take bands out too. Like if a band is in, I generally think that over time it's going to become more of a problem as opposed to less. And so I think the idea of getting it out is solid. Doing an ESG at the same time, totally doable. Interestingly, if you have a laparoscopic in there and you can actually see it while you're doing the endoscopic sleeve, it's kind of interesting. And I've seen a couple, like there's like one video out there I've seen of laparoscopic and endoscopic at this ESG happening at this laparoscopically visualizing an ESG happening at the same time. Yeah. It's a really interesting video. But that's, whatever, that it's absolutely doable, Katie. And if you're interested in talking about it, certainly reaching out. I think that's, that's something we talk about, all the different options. So this is always a very what's going to be best for you. And we just lay out the options. This is our philosophy in general, the way we take care of patients, which is here are all the tools. Where are you coming from? Which of these sounds best to you? What are your questions? How can I help you? So we're just here to help you.
Yeah. A lot of options. Right. A lot of things we can go from a band to something else. So
yes, lots and lots of options.
I have another comment. I think it's just a comment. I used liraglutide and it totally stopped the food noise, which is amazing. But I did end up having the sleeve last July, but nothing has stopped the noise like liraglutide. I think that's liraglutide is the GLP-1, kind of in the same family as the Ozempics and the Mounjaros, and I think we hear that a lot actually. And I think this is a good segue because with the mindset piece, Brandon, you're talking a lot about this. I think it's I always tell my patients during our consults, what a surgery can and cannot accomplish and what surgery does and does not do. And surgery, what we're doing is we are doing a lot from a physical standpoint to help you lose weight, from a hormonal standpoint, from a metabolic standpoint. But the one thing that surgery does a poor job of addressing is kind of your brain and setting the correct mindset, which is 50% plus of the battle here. Yes, we are doing a lot with the surgery, but without that second half of the piece, you're not going to be as successful as you could be. So I think it's incredibly, incredibly important.
Well, that's right. It's procedure. It's program, the whole plan about how you put all those pieces together. I describe obesity as this all the time, which is people that really struggle with their weight, right? What they describe to me, they feel like they're essentially trying to drive a broken down car. right? The car just doesn't work very well. The steering sucks, it's sloppy, throttle's really jerky, the brakes don't work, transmission's all clunky, whatever. Like it's just not working well. And what surgery does, and I'd say the medications are starting to do now more too, it tunes up that car and it tunes it up. And what happens is that, okay, now you have a tuned up car, but you still got to know how to drive. Like you got to know how to use it. You got to be paying attention. You got to know where you're going. And so with all of those things, with a functioning car, like with a body that's, tuned up, plus the plan of like, I think, and now this is the topic I was hoping to talk to you about today, which is like a really good mindset and inner voice, where you're like, where your mindset's like, I know where I'm going. I have a plan for my nutrition. I have a plan for my health. I have a plan for my stress management. It talks to you about, who am I? Why do I do things? Why do I keep going when it's hard? And those are the things that I'd say, all those mindset and the inner voice pieces, when people talk to me after a year or 2 or 3 after surgery, one of the best things that they say after surgery is the improvement of those things. It's not like the weight on the scale is fantastic, right? Like the way they feel it in their clothes, the stuff that they can do now, they love all that stuff. But what they really, really love is where their head's at and where they feel who they are, who they have become as a person. And that is why I think bariatric surgery is actually the best job in the whole world, because, it's such a cool to be a part of, just empowering people to really start living their life, which is awesome. So,
yeah. So in the pre-op, kind of before surgery phase, is there any advice or anything that you try to work with your patients on in terms of setting the right mindset to prepare for surgery?
There is. Yeah, there's quite a few things. But can we put a tag in that?
Okay.
I don't know on your side. I got a bunch of comments on my side. I got to get caught up on. So YouTube comments, Kamlesh. Okay. Should we champion intervening in someone's natural path through life? Good question.
Repeat that question.
So Kamlesh is, there's a couple other questions here. Montois Pace to be, okay, so ignore that question. Should we champion intervening in someone's natural path through life? I would say wholeheartedly. I think that our lives are, I have had a lot of people intervene in my life and say, hey, I think you should go in a different direction. And here is what, I don't think this is going to really bring you joy or peace or happiness in general. And I think you should go a different direction. And I have been immensely benefited from that. And I think, all of our own successes, I don't think any of us, it's never a success when someone's going through their own path. I'd say, I don't know if this is what your question was necessarily, Kamlesh, but I think when someone's struggling and when someone's going through a hard time, and going in a downward spiral, I think helping them with that's always a great thing. And then when those people are succeeding and doing well, then they have more ability to help other people too. Yeah, that's a good thing.
Yeah, it's a very philosophical question.
Yeah,
I
it
think
is.
Everyone needs help sometimes. So
absolutely, I'm a big person that believes in in grace and in mercy. That we don't always. I'm thankful that I don't always get what I deserve, and I'm thankful that I get sometimes what I don't deserve. So. All right, let's see here. I got some other questions. All right, Jen Pearson. I heard that if one is on antidepressants, malabsorption can be an issue. Then the medication won't work as well and depression can be worse. Is the sleeve better to get in this case? Great question, Jen. So malabsorption with medications is not, for a sleeve, it's hardly an issue at all. Like, I don't know, in your experience, usually like iron supplementation it has a little bit harder time getting absorbed on that's something that we do see. So we need to address at times, but the rest of medication wise, I don't really personally see a lot of issues with absorption or with medications. With a bypass is a little bit different story. There are some medications that aren't as absorbed as well. And actually from an antidepressant standpoint and a lot of psychiatric medications, lithium is really the only one that I really see as one that we may need to adjust levels. And lithium also has a narrow therapeutic window. So that's a very important thing to stay on top of. But the rest of them, I see very little active titration that we need to do. That's necessarily related to the surgery, sometimes related to their life events. And they're just like, I'm just feeling better. And as my weight is going down, I just feel like a burden's been lifted. There are some people have to come down on their medications, or like, I'm moving through this period of my life or this episode. So yeah, I would say the medication thing especially for antidepressants wise, these are generally very helpful tools actually in moving people forward. Does it fix all of your problems? Absolutely not. Like, there's still lots of people that don't struggle with their weight, that still struggle with mental health things. And that's not like, obesity is not it's not the cause of all problems of people that have obese, which is the way a lot of obese people feel they get treated, which is, if you have a problem and you're obese, it's because you're obese, right? Which is not fair, and it's not even, and not true either. So yeah,
I think it is a good question. It's a good one to be very aware of for after surgery. Because I do think that we do not understand medication absorption and kinetics and dynamics after bariatric surgery as well as we would like to. Actually, we know very little about it. So I usually tell my patients to be very sensitive of like to kind of be aware of the fact that, yeah, maybe your current dosage might not affect you in the same way as it does after surgery. We don't fully understand when or why that happens to some people, but sometimes it does maybe take some titrating. But yeah, usually the sleep, we don't see a ton of, I'm not usually too concerned about the absorption, but
yeah,
it's one of those I feel like
keep an eye on it. Always keep an eye on it.
Yeah.
Yep. Mary, I am 265 pounds, going to doctor in July 1st about medications. Nice, Mary. Way to reach out and get some help. Awesome. Excited for you. Mary, where are you located? We are in Shoreline, Washington. So that's just north of Seattle. We have a surgery center here. We do surgeries. We have our medical weight loss team is based out of here, but we do most of our visits telehealth, so we can take care of a lot of places. We have medical licenses in multiple other states. And then we do hospital cases at Evergreen in Kirkland, Evergreen Health. So yeah, that's great. We love it here. And we love taking care of people. Okay. Frilp, Frilp, is it a live or video chat? Well, I think this is actually a live video chat, in fact. The way we do our visits is telehealth. We do a lot of telehealth visits. So
yeah. Although I always tell people, if you want to come see me in person, I'm more than I like seeing my patients in person.
Yeah. If you want to be seen in person, it is nice. Yeah. All right. Mary, planning in time. Why? What about the brain? Mine won't. Not sure what that means. 56. Can we address age? Hormones. Great question. So Mary asks, can we address age and hormone changes? I'm assuming related to like menopause things, because that's a very common one. No one's going to say that menopause makes it easier to lose weight. No. That's unfortunately, that's just the truth. Honestly, no one's going to say that getting older helps you lose weight either. So, but I will say I do not, like, I have seen these tools work fantastic for 70-year-olds. Like, like it's really cool when you have, you have a procedure, you got your mindset in the right space, like you have this physiologic change, this tune up to your body, plus you got the program behind you and you're like determined to succeed. And it's fantastic. It's really cool to see what can happen. Mm-hmm. Is it a guarantee? Of course not. Like, there's no guarantee in life, in medicine, period. It's like in medical school, right? When you're learning to do multiple choice questions, if it ever says always or never, you can literally just cross that question out, because that's a
good tip, right there.
So yeah, I recommend that for when you go through medical school.
Yeah, that's about time.
Yeah, so it's very common that we see a lot of patients that are in menopause, and these tools still can work really well for you. And sometimes we just it's just about figuring out what's going to work best for you, working out what's going to be best in your program, and the best tools and the best ways to use the tools that we have. So you'll have with all of our things, like with our medical weight loss, with our nutrition team, with our surgical weight loss team, like we all work together, and you see a lot of us, honestly, and you get kind of sick of us because this journey's hard. Obesity is hard, and none of us can go into your genetics and change them. And none of us can go into prehistoric past and change our evolutionary process to get here, which is honestly, your brain thinks you need to get as much food as you possibly can. Life's really hard. You're going to have a famine and winter's coming. Like you're going to die. So eat as much as you can right now. So
yeah, I would say like for women, because I always ask like my patients when you started struggling with your weight or whenever your weight really went up. And it's always like, there's a couple of answers. It's like one since childhood. That's like one, or like college is another one. Pregnancy is the next one. And then menopause. Like those are always going to be the spikes in weight that people have because yeah.
Classic. Mary, a couple more questions here. Scrub Tech, nice. Park the car. What do you think of semaglutide long term? That's a good question. So I'd say I guess I'll lead here, Dr. Dan. I would say the jury's out. The jury's out on semaglutide long term. I think we need to watch it carefully. I think we've seen a lot of positive stuff with semaglutide, and but I think we need to keep our eyes open and to keep a close eye on it. Mm-hmm. I don't think I never go into a therapy or treat anything. My goal with any therapy in medicine is to not have you be on a medication for the rest of your life, semaglutide included. If we can find a way to titrate you down off of these medications at some point, I think that is the best thing in general. Best thing for your pocketbook. It's best thing for probably your physiology. These things are several like 6 to 7 times X normal physiologic levels of some of these otherwise naturally occurring hormones. And, there isn't a therapy in existence that when you are changing things like that, there's not other downstream issues with that. We just may not know what they are yet. But something to keep an eye out. So far, I would say the benefits way outweigh the negatives from what we've seen, is my opinion. Dr. Chan, what are your thoughts?
No, I agree. I mean, I think concern is legitimate and being watchful is legitimate with these medications because they are newer. But it is hard for me to feel that the immediate risks that weight kind of poses to some of my patients, somehow that I feel like that far outweighs these potential negative side effects that we might see down the road and we might not see. But that said, I also like when I start these medications, I do usually set the intention that most people, when they come off the medication, do tend to regain weight. Maybe not all of the weight you've lost, but there is a tendency where we've seen that in studies. So there are probably a good chunk of people who cannot wean off of the medication without or gaining weight. But I do think it's worth trying with my patients. Because why be on a medication if you don't need to? With the intention of weaning very slowly, and then if you start seeing weight regain, then we go back up. But still a lot to be learned, I think. But a great tool for us to have in the immediate term right now.
Yeah. Mary says behavior is the battle. Yeah, it's really true. That's where the hard part about, I think a lot of people getting their heads around the medications, the surgeries, which is that, well, if this is a behavioral disease, like just change your behavior. What's crazy is that like it is so hard to swim upstream for every minute of your life. It just is. And what these tools do is it changes, like when you just keep every day, every minute of every day is climbing the mountain, climb. And you can't do it. Like, it's just not, that's not a thing. And for 90, it's not a thing for 96% of the population. And it's great for the people that can do it, that are the 4% of it that can lose serious amounts of weight and keep it off. But that's not a successful public health intervention.
Yeah.
That's a failed campaign, essentially.
Yeah.
If you're getting 4% efficacy rate, that's a failed campaign. And with bariatric surgery, our losing meaningful amounts of weight and keeping it off for long periods of time, like years and years, is still in the 80% plus range, that's a successful tool, right?
Yes.
And so when you just compare those numbers, they're inverse. They're inverse, So it's like, yeah, I totally agree. Behavior is the battle, but I wish that there was a way to change the behavior without having to do surgery. But unfortunately, like we just haven't seen anything like that.
Yeah.
And even the medications that the semaglutide that we're seeing now, like it still doesn't have the efficacy of the surgeries. So
yeah, and behavior is important, but this is also the biggest argument that people make about, well, why do you need surgery or a medication? And just because behavior impacts or influences this outcome for you, that doesn't mean that there isn't an appropriate medical intervention that we can help you with, right? I compare it to like lung cancer. Just because you're smoking doesn't mean that when you get lung cancer, we're not going to operate and treat you for your lung cancer. And I feel like a lot of people have this attitude towards obesity, which is obesity stigma, that, well, okay, you could have just ate less and then you wouldn't be in this situation. But just because behavior can influence your weight, that does not mean that you don't deserve the most effective treatment there is out there. So, yeah.
And as much as we think that we're totally in control of our behavior, like trillions of marketing dollars tells us otherwise.
What, me buying stuff off Instagram? What? That's not.
Yeah, no, this is great discussion. So a few more here. Thank you from Mary. You're welcome, Mary. Mary, again, what do you think about semaglutide long-term effects, pancreas, etc.? Pancreas wise, good question. Got to keep an eye on that one. Thyroid wise, same thing. Keep an eye on it. But I think right now benefits outweigh the negatives from what we've seen. So
they've
Dr.
actually
Chan,
seen very little. Yeah, they've seen. I think the papers I've looked at have not actually really seen much incidence of pancreatitis with semaglutide or tirzepatide, I believe. The older GLP-1s, they have seen a bit more of an association. So I think the theoretical risk is definitely there. It's something that I kind of counsel all my patients about and ask about. But the thyroid issue is definitely one to keep an eye on. I think that one's very important to know about moving forward. I would caution anyone who has a strong family history of thyroid issues against some of these GLP-1s, I would say, without strict monitoring.
Kamlesh came back with another question. Should we be expected to feel bad, depressed, worried naturally as the normal reaction to life's problems? I think we should expect to feel bad when things are bad and feel good when things are good. I think we should try to change their emotions by introducing medication. Okay. Yeah.
Philosophical.
Yeah. This is one part of the journey. Maybe this doesn't quite address the question. Question/statement from Kamlesh, but I would say that one of the pieces of the journey of losing weight is honestly, and I'd say maybe some people that are on here that have had weight loss surgery and things like that can actually attest to this, which is that feelings are I think, Kamlesh, you're totally right. Your feeling of something is usually correlated to some experience that you're going through, but when things are really hard and they're challenging, it doesn't feel very good sometimes. But there's a difference between pain and suffering. Pain is when you're working out and you're like, this is really hard and this is not feeling very good. But I'm doing this because I know this is for a good reason. Suffering is when you're going through something and you're like, there's also an emotional piece connected to it that's like, this is miserable. I'm going through such a hard time. And I'd never want to do this again. This is the worst thing ever. I want out of this as soon as possible. And the difference between those two is really just mindset, about where you are in your mindset. And I think the power of where your mind is at and where your mindset's at with these things, with the experiences, is also something that a lot of patients really say is a great part of, is a really beneficial part of this journey, which is saying, you know what, before my behavior was determined based on how I kind of felt about things. And now I feel like I'm in more of the driver's seat of my life and in the driver's seat of my body, which is, even if I don't feel like eating healthy, or if I feel like eating something bad, or if I feel like overeating something, you know what? I'm just like, okay, hey, I'm just going to do something different this time. And I'm going to change this. I'm going to act in this way instead of the way I'm feeling. And I think that's incredibly empowering for patients.
Yeah.
And that's an incredible part of this journey that I think is the part that I probably love maybe the most. So yeah,
I mean, I hear this all the time. I feel like I've lost control. Like people describe almost like this snowball effect of how their life, or how their weight has kind of changed over the years, and it's really empowering to be able to get back in control of that, knowing that there's a tool that can help you with that.
Yeah.
I have a question here. When you're 100 pounds down, congratulations, but still could use to go another 15 to 20. It gets really hard to lose that last chunk. These meds do seem to help get that jump on that last amount. Opinions on that?
Agree.
Yeah.
Honestly,
I think
the last 20% is usually as hard as the first 80 to 100. Yeah.
And I don't know where the starting weight was this person, but sometimes, there are limits to how much you will lose with a bariatric surgery by itself. And sometimes it is shy of like that goal weight that you have for yourself. So these meds are incredibly, incredibly powerful in helping a lot of our patients kind of get closer to that goal. So
yeah. What I encourage patients to do when they're in the final, because you kind of generally the weight loss is like goes down and then it slows down, you're plateauing, but you're like, I want to plateau down here, not where I'm at right here. It's really easy to get discouraged during that time. And I tell people like more so than ever, this is a time to really be focused on the process and not necessarily the outcomes. So by that, I mean, if you put your emotional energy into like, okay, what's my diet going to be? Like what food choices I'm going to make? How much am I going to eat of them? When am I going to eat them today? Like have a plan, have a structure. What activities am I going to generally partake in? Like, am I going to park far away? Am I going to take the stairs? Am I going to do this? Am I going to do that? And then am I going to be exercising? What am I going to do for my exercise? Am I getting sleep? Am I managing my stress? Like that's where I want you to put your energy into. And then just try to just do a little bit better each week. If you're just doing a little bit better, just in small increments, where you're going to be in 6 months, in another 12 months, another 18 months, seems like a long time away, but it'll be here fast. And if you're in a better and healthier place than you are right now, very, very good chance that you're going to be in a good spot, that you're going to have made great progress with that. So
I think, the mindset issue that is probably most important further out from surgery, like a few months, year plus out from surgery, because initially after surgery, everyone's excited, motivated, we're on like super on track. But as you move forward, there are behavioral shifts. You kind of shift back into old behaviors or whatever. And it's very easy to get discouraged, right? And I think there are a lot of patients who kind of expect perfection out of themselves as well. And it makes sense. You've tried to lose weight a lot of times in the past, and feeling like any sense of failure or lack of success can really bring you down. And so I always really I spend some time like on these longer term visits being like, be gentle on yourself, like realize how far you've come. And yes, you still have a ways that you want to go, but we'll get there in due time. And you do want to make some, and when you're making behavioral changes, going small is really, really important. Because I think it's really hard when we're like, oh, we'll just reset everything, just reset and do everything perfectly again. Like that's not realistic. So yeah, I really like the idea of like setting small goals for yourself, maybe one every week that you can accomplish relatively easily, and then build on that. I take this approach in my own life with exercise. I call myself a lazy exerciser. Like I'll be like, I can do like 5 to 10 minutes right now. And then that's never like intimidating to me. So I'm like, I can do that, and then maybe later I'll do another 5 to 10. Like the idea of like a 30 to 60 minute exercise routine is very intimidating to me. So I'm like, I'm just going to do my lazy exercises today, It's, yeah.
Cool. Yeah, no, that's a big one. Mindset coming into play before surgery. What do you see as the most, when people come in, they're like, oh yeah, I'm really excited for surgery. How do you start helping them prepare their mindset?
Yeah, I think there's like a couple of just expectations I like to set, like that are realistic prior to surgery. Like, are your weight goals realistic? Are your overall goals realistic prior to surgery? And just kind of doing some education from that standpoint. And I think that helps in the back end, with maybe like feelings of disappointment or failure after surgery. But I think like a couple of things I really hone in on for people in practicing mindset prior to surgery. One, I think having a support community or a support group for yourself after surgery is incredibly, incredibly important. You know, we have a questionnaire that we make our patients do, and we actually have them identify like who are the people in your life who will support you after surgery. And I think that's actually like a super important piece in all of this. And then ideally you have some people who have undergone surgery as well. And I encourage those patients to spend some time like getting to know what the process feels like after surgery. And then I also have my patients start practicing right off the bat some of the things to kind of get into the habit too before surgery so that they are really well prepared after surgery as well. But and then I try to like make my patients feel very confident for their road ahead. Like we go over a lot of like Debbie Downer stuff during our visit, like complications, like bad things that can happen. But I want my patients to feel confident going into surgery because I think that actually will produce confidence or produce success post-op.
Yeah. No, that's important stuff.
No. Is there anything specific you like to do beyond that?
I try to be fairly generic. So, like I've gotten involved with the mindset app.
Mm-hmm.
So I've gotten involved with this app called Superior Mind that I find to be really helpful. Like I use it almost every day, and it's a visualization app. So if you're not familiar with visualization is just essentially like you can just sit there and you can close your eyes or not, and you just think about how you would do something. So I remember you probably did this, and I mean I did this a ton when I was learning how to do surgery, because there's only so many surgery opportunities that you get, right? When you're a resident, when you're training. And so you're thinking about like, how am I going to do this surgery? Like from start to finish, how do I want this thing to go?
Mm-hmm.
And you live it and you do the actions in your mind. And interestingly, and that's the same thing like with sports, like all sport, like serious sports athletes do a lot of visualization. A lot of them have visualization coaches, like performance psychology coaches that do like every professional sports team has at least one sports psychologist on staff. Actually, I was just watching the Welcome to Wrexham, and one of the episodes was with like their sports psychologist, like their performance psychologist.
What's Welcome to Wrexham?
It's a documentary with Ryan Reynolds and Rob McElhenney's soccer team that they bought in England, in Wales.
Oh, is this like the real Ted Lasso?
Yeah, it is. It's pretty entertaining. So anyway, but I think that's a really helpful. I find it a really helpful tool, just about like staying on track with where I want to be, kind of getting my mindset back to, trying to focus my mindset away from some distractions and toward what I want to do, and really making sure I have a positive inner voice to overcome obstacles and challenges and deal with that stuff well, and keep going and going along and doing all the things I think I love doing and I want to do with my life and with my career, with my family, and things like that. So I share that app with them, and I say I think this would be really helpful. It's kind of like, it's a little bit like working out though. Like you do have to stick with it. You got to be consistent, and with that though, it's pretty. I find it to be really helpful. The other two things that I really encourage patients to have is a mantra. I think a mantra, which is like a mantra, if you're not familiar, it's like it's a really simple phrase, short, like like David Goggins is classic for mantra. He's the ex-Navy SEAL ultra marathoner. And what he does, he just says, get after it, right? And he just says that in his head over and over and over and over again. And mantras are very powerful things. Like most people that have gone through like some crazy stuff in life, like survivors of, like of a wilderness, like being stranded in the wilderness or on a shipwreck or whatever it is, like so many of these things that people get through tough times, or like athletes particularly, they just have a simple word in your head and you're just saying it over and over and over. You're just over and over and over. And that's the only thing you're focusing on. It's sort of like this. It's like, I think I can, right? I think I can. I think I can. I think I can. You're the little engine that could, right? And I think that's a really helpful tool. It's a very concrete, very simple tool that can really help you get through and get you out of your own head a lot of times, get you out of whatever you're doing and be like, okay, I'm here. I want to be over there. And here we go. The only way I'm going to get there is just churning out this statement in my head over and over and over and just, pointing myself in that direction and putting my head down and going. So I encourage people to try a mantra, to start working on that. And then, and I don't always talk about this stuff because sometimes I already get kind of pedantic and,
it's a lot of information.
It is. And it's so much information, but I do find like, I kind of tailor that to like, I think if this person will really benefit from it, then we talk about it. The other thing I think is a great thing to talk about sometimes is a neutral coping skill. And so, I think everyone, it's really important. Food is such a coping skill. And so many of the things that we have in our lives are coping skills, or just like a little bit of cope with whatever it is we're going through. And part of this journey it's really helpful to rebuild your coping skills away from food. And a neutral one is best, I think. Something that's not super constructive, like working out or cleaning or self-development, or whatever it is, right? That's great. If that's you, God bless, if that's naturally comes, wonderful. But for most of us, it's like, I'm kind of going through a hard time. I don't need something that's even harder to try to do on top of that. So what I say is like something like, maybe some artwork, some painting, or like some photography, or like puzzles are great ones, crossword, playing some music, something that's very easy to do. Ideally tactile. I try not to do I try not to recommend screens in general, or things that are where you're sort of you're living a life outside of yourself, like where you're transcendent. You're like, I'm watching a show, like I'm watching someone else.
Tuning everything out. Yeah.
I'm playing a video game and I'm living a life in a different video game, or I'm watching sports, right, or things like that. I don't think those are they're not negative. They're not huge negatives. They're not like major bad things for your body or mind, but I don't think they really help you process your stuff, right? That's the nice thing about a neutral coping skill, is that it gives you the space to like get distance from some of the things that are in your head, but it also gives you some space to process some of the things that are in your head too. And you kind of have that space in there. Like that's where puzzles, I think, are a great one, right? You can, and puzzles are nice because you can kind of have your family around, and sometimes you can do it, and you can talk or not talk,
right?
And you can do the puzzle and you can talk a little bit. And so, and then the negative stuff is, of course, like, drugs, alcohol, nicotine,
gambling,
gambling, shopping addictions. Those can be a real thing. Weird sexual stuff can come up. So,
yeah. I think, I do when this comes up, I think it's good to think about what food gives you currently. Like, is it a stress release for you? Is it just a boredom thing? Are you truly getting happiness from eating? And then finding an activity or something else to do that will replace that, knowing that it is going to feel like a loss in your life when you're not able to do that. And so you have to have something else that is going to be able to replace that for you,
That's the neutral coping skill.
Yeah.
That's a good way to articulate it. Like, what does food do
right.
for you in your life?
Yeah, exactly. I hear that a lot now with the GLP-1, which is interesting, which is like, I no longer have interest in food, and food used to be all these things for me. And now
there's this hole, right? There's this hole in your life now.
Yes.
Where you're like, I don't know what to put in here. It can be scary for people.
Yeah.
For sure. So all right. Well, we've gone 50 minutes here.
I know. It's been good. There have been some really good
great comments and questions in here. Yeah, thank you.
I have a couple of comments that I'll just read here, and they're not questions. I'm having a revision from sleep to bypass. Finding people who've had this scenario is so much harder. Was 400 down to 231. Scared for this surgery because I don't know what to expect, but I'm excited. I'm excited for you as well. Sleep to bypass. It's one of the more common revisions that we do. So a lot of people are going through what you are going through as well, but certainly a rarer subset than the general bariatric community. Oh, and then someone else was, that's me, but I started at 300, not the 400 and 230. And Dr. Landerholm did his second surgery. It's already got me another 33 pounds. That's awesome.
Awesome.
Congrats to both of you.
Okay.
That's awesome.
Another Kamlesh coming back. I really think that the small amount of metrics used to calculate BMI is not enough. Couldn't agree more. BMI is a very crude instrument. It is not, people have very different frames, very different, the way that they carry their bodies, just look at a football team, honestly. Like there's very different body types on a football team. And those are like premium athletes, like professional athletes for some of them. And BMI it's a very crude instrument, and it doesn't accurately reflect, I think, what is a healthy weight for some people. And that's why you need a personalized approach for whatever you're doing. Yeah. So BMI is, unfortunately, it's just, there's no perfect metric until we have a very easy way to measure body fat composition that's accurate and universal and more like, standardized between all different sorts of modalities. I think that'll be the standard at some point. But right now there's too much variation in the way that body fat percentage and accuracy in the way that body fat percentage is measured to do it at scale. So
yeah, and where your body fat is, that's important too. So
it's huge. It's huge. So all right. Any other questions or comments to address?
No.
Yeah. Thanks everyone for all the engagement. Really appreciate everyone tuning in. And yeah.
All right. Cool. That was great.
Great. And I look forward to you guys joining on the next one. We do try to have, we're going to try to start having a little more themes for stuff. And if you have questions or comments, you can DM us, you can leave it in the comment section in some of our YouTube videos, and we try to get to those.
Yeah. Suggestions for themes or topics.
All right.
All right.
Fantastic, everyone. Well, thank you again. And thanks for tuning in. We'll be in touch.
All right.
Until next time.